My name is Jane Madell. I'm a pediatric audiologist. I'm certified as an audiologist and a speech-language pathologist and an auditory verbal therapist. So I have my hand in a lot of different pockets or something. When I went to school, I got certified in both audiology and speech. That was something that was easier to do 100 years ago when I went to school. And so when I started working, I sort of had to make a decision about where I would expend most of my energy. And I chose to do that in audiology. I'm not really sure why I made that decision, but the fact that I had training in other areas really helped me, I think, to be a better pediatric audiologist. I've been doing this for a very long time, about 45 years, and so I've seen an enormous amount of change in this field. I mean, when I started, technology was very limited. Kids who had more than a moderately severe hearing loss couldn't expect to hear well enough with technology to be able to use listening to learn. So they worked very hard in order to manage in a regular school setting. And their parents worked very hard in order for them to manage. And fortunately, deafness it's not the same old deafness. What's available now for kids is so much different that it just makes life easier for kids and for families. Technology now lets every kid hear, and so our job is different than it was when I started working in this field, a long time ago. I remember, telling families that they had a child with a hearing loss was very hard. I would get a pain in my stomach, sitting with a family and giving them this news and watching their grief and listening to their sadness and their feeling of being overwhelmed with what is a hearing loss. And, this was before newborn hearing screening, so they had been living with this child for a while, and most of the families who came in knew something was wrong. That's why they came in. This wasn't something that got picked up on a routine screening. They came in because their kids weren't learning to talk, and they could see their kids weren't hearing. And so they were already sad when they came in because they knew something was the matter. And some parents were happy to hear that it was a hearing loss because that was something you could wrap your hands around. And some families were just overwhelmed because they were getting a diagnosis of something that they didn't know anything about, because the truth of the matter is that 98% of children with hearing loss are born to families with normal hearing. And so these families have a whole new world that they're exposed to, and they are overwhelmed when this news hits them, even though in those days they knew something was wrong and they brought their kid because they knew something was wrong. The people who worked with me used to say they could always tell when I had made a new diagnosis because I was sad and I wasn't my bubbly self, and they could tell that, I remember the person who used to dispense hearing aids would say to me, "You found another kid today, right?" And that was, I was sad not because I think deafness is a bad thing, but because I knew that this family was sad and that they had a big job ahead of them and they were overwhelmed by it, and that was hard for me. I used to go home, and my son, I remember when he was maybe 5, would say, "You had a bad day, Mommy." I mean, he could also see that there was something. I had just sort of this overall sadness when I found a kid with hearing loss. It's better now because it's more hopeful. I mean, I know that these kids are going to have an easier life than the kids who I identified 25 years ago, but there's that sadness. I don't cry now every time I diagnose a kid with hearing loss, but I still feel sadness. I mean, I've matured so that the tears don't run down my face, if that's maturity. But at least, it's not like the sadness goes away, because you're giving news that some parent doesn't want to have. This child you bring home your perfect new baby, you watch this baby grow, he's adorable, but there's something that's not right, and that's very traumatic for everybody, not just for the parents and for the grandparents and for sibs, but also for those of us who work with these kids, because we know what's involved, and we know it's hard on the families, and so it makes us sad. But on the other hand, I mean, things are so hopeful now that, sort of helping families navigate the system is what the joy of this is. And watching these kids grow up and be, these wonderful, successful adults. In the last year, I've had 3 of my babies get married, and there's, you go to this wedding and people, and it's like the parents see you, one of the families said to me, you need to be the 3rd person to walk her down the aisle because she wouldn't be there if you hadn't done this. And obviously I'm not walking her down the aisle, but you just sort of feel like it's, she's my baby who's getting, it's one of my babies too, who's walking down this aisle. I got an email from one of my babies who's married and has a kid, and her son is not speaking well, and she wrote to me in a panic. What should I do? He's had his hearing tested. I know he has normal hearing. So it's like, okay, so we can handle this. We'll just have a speech eval. We'll figure out what to do next. But I think if you do a good job, these families, you become part of the family. You're a member of these people's families. And so you have a very, very big family by the time you've been in this profession for a number of years. And there are good things about that and bad things about that. I remember having a discussion with one of my kids when she got to be a teenager. And I don't know why it occurred to her to ask her this question at this point, but she said, so what, do your kids continue to see you? And I said, well, a lot of them, when they get to be adults, go see somebody else, but some of them continue to stay. And she said, why would anybody want to go to someone else? And this kid is now in her last year of medical school. And I'm still having this discussion with her. She no longer lives in New York. She's in medical school in Louisville, Kentucky. And I said, you need to find an audiologist in Louisville because you need your hearing tested. You need someone to map your cochlear implant. You can't do this long distance. And she finally agreed and went to see somebody in Louisville and said, okay, now she had 2 people she could count on, which is a good thing. You should be able to have a number of people you can count on in your life. Sometimes, I don't think we realize all the time how much where we are affects the families we work with. I mean, sometimes we say things inadvertently that we didn't really mean to say. I can be sarcastic. It's part of my sense of humor. And sometimes it's not a good thing to do because sometimes people who don't know you well aren't comfortable with that. And, I can think of families who were not comfortable with my sense of humor, with who I am as a person, and who just felt like I wasn't hearing them. And sometimes I wasn't hearing them because I was too busy with other things in my life, something going on in my life that's interfering with my listening. But I think that, families know when you're there and when you're not there, and they get it right away. And if we can, if you're not ready to be there for families, you need to sort of go someplace and take 3 deep breaths and get yourself into a position so when you walk into a family, you're there. I mean, there have been times when I fortunately not many, but I can think of times in my life when I have not been ready to listen. And families knew that and therefore couldn't listen to me because we weren't communicating. I mean, I'm thinking about a family where I told them the child had a hearing loss, and the father said, his attitude was, you're wrong, you don't know what you're doing, and you can't I live with this child, I'm telling you this child doesn't have a hearing loss. He was very upset. And what I should have done was said, I understand that you're upset. Let's talk about what I need to do to help you figure out what you need to do for your child. But I don't know what was going on with me that day, but I got defensive. And said, I've been doing this for 25 years. I know what I'm doing, and I'm telling you this child has a hearing loss, which may very well have been the worst thing I could have possibly said to him, because he then, his attitude was, I'm taking my kid and leaving. And I don't know, the family he wouldn't talk to me again. I couldn't figure out what happened. I knew that I had answered him. I knew that I had not done what he needed. And the problem was that the kid was now gone, and I didn't know whether this child was going to get help. I found out subsequently that it took them almost a year to go to somebody else to get assistance. And eventually they did. Eventually the father came back to me and yelled at me and told me how awful I had been. And I told him he was right, that I had not handled it well, and that I apologized, and I couldn't apologize enough. But it didn't matter, because this kid had lost a year because I had been brusque. Now, I don't know for sure that this father would have followed up if I had done a perfect job. I can't know that. But I know that I felt guilt for years about what had happened, that maybe I had been a part of this kid not getting help right away. But fortunately, that hasn't been my typical experience. Fortunately, most of, I probably have seen thousands of kids over the last 45 years, and most of them, families just are very attached. The families who think you should walk their kids down the aisle because you're the reason the kid is there, which of course is not the case. I'm not the reason the kid is there. I just helped them find the road. They did the work, and I just sort of helped move them along. But, that's what happens that makes this, that's why we do this work, because we look at these kids and we see we can help this family move ahead and have and even though they're in Holland and not in Italy, they can still have, this kid's going to have a terrific life. You become part of these families as you work with these kids over the years. I'm thinking about a family I worked with who had 2 kids diagnosed with auditory neuropathy, and as the father said to me, we've both been very blessed, and nothing bad has ever happened to either one of us in our lives, and we don't know how to deal with this. And in some ways, maybe they hadn't been blessed because they'd never experienced sadness, and they just couldn't deal with the fact that something was wrong with their kids. And unfortunately, they weren't getting support from their families because the grandparents said, you have all these other, our other children are going to be suffering. If you have 2 children with a problem, who's going to want to marry? And no one's paying any attention to the fact that there are 2 little kids here who need help, and everybody is thinking about their own issues. And I just, I spent days with this family, getting in the grandparents, getting everybody in to try to figure out what we could do to provide these kids' needs. And it took a long time to sort of get everybody to understand that everybody had to put their own needs a little bit out of the picture for a few minutes and figure out what these kids need. And grandparents didn't want the kids to wear their hearing aids when they were in family events because they didn't want everybody else in the family to know the kids had a hearing loss. Not really that unusual. Grandparents are sometimes, they don't want to have, I don't want something wrong with my grandchild. I've brought my children up already. This is supposed to be the perfect time in my life. Everything's supposed to be easy. And the trauma of having a grandchild with a hearing loss is very, they're having a trauma also. And people have to, we don't pay attention all the time to the grandparents. But once you get the grandparents in there and talk to them about what's happening and what this child needs, the grandparents can sometimes be very helpful in helping the parents move ahead and do what has to happen. And sort of be the extra set of hands and be somebody who's there to hold on to you and give you a little bit more support. I remember, when cochlear implants, I mean, cochlear implants changed the world for children who are deaf and hard of hearing. And I remember, the first kid, when we turned on the first kid's cochlear implant, and this is, she's long past graduate school now. This is a kid who was one of the first few kids who got implanted. And she was a kid who had meningitis and lost her hearing and then got implanted. She was a baby at 2. And I remember, just the light in her eyes when she heard, that sort of stunned look, that sound was there, and you sort of knew, okay, she's going to be okay. She's on her way. I'm thinking of one of my kids when she got a second cochlear implant, turned on, got a second cochlear implant, which had a T switch on it. She'd had a very early model of her first cochlear implant, and opened up her telephone, took her mother's cell phone, turned it on and listened, and she said she called up her father and was having a conversation with her father on the telephone. One of my kids had a body-worn cochlear implant. It was before behind-the-ear cochlear implants. For her Sweet 16, she was an absolutely gorgeous girl. She was wearing a strapless dress, a very tightly fitted strapless dress, and her cochlear implant, her speech processor was like this big. So there was no place to hide it in a strapless dress. And she was trying to figure out, she needed to get out of this. And the cochlear implant company had just started with BTEs, but they were doing clinical trials with adults, and they didn't have them for kids yet. And I called them up, and I just begged them to lend me a behind-the-ear speech processor for a weekend so she could go to her Sweet 16 and have her hair up and put her cochlear implant on her ear and not have wires going down into her strapless dress. And they lent me one. And she was in heaven that she was going to be out there like every other kid and be able to wear what she wanted to wear. And she didn't come back to be remapped for a very long time for fear that I was going to take away her behind-the-ear speech processor and she was going to have to go back to the box. But eventually we made it clear she could keep it. She just had to come back and let us map her again. But, it's those putting hearing aids on kids and watching them listen. Or I just got an email from a mom who sent me a video of her daughter's first birthday party where she could sing some of the words to the happy birthday song. And this is a mom who had a very hard time accepting a hearing aid. She knew her child had a hearing loss. She came in. I kept retesting. She wouldn't let me make ear molds. It took a lot of hand-holding, a lot of meeting other families. And finally, I got her to accept hearing aids, and she put them on, and it was with a great deal of pain. If I put these hearing aids on, I'm going to have to admit that I have a child who has a hearing loss. And it's just, I don't want to do it. But eventually, she did it. Her husband was there ahead of her, but sometimes you have to wait. And then for her first birthday, her mom was so proud of her. She had a birthday cake which had a teddy bear with hearing aids on, so that because she was fully ready at that point to accept that this was her child and that it was okay. And she sends me this picture of her video of her daughter singing Happy Birthday, as only a 1-year-old can sing Happy Birthday. But a perfect 1-year-old. And here she was. She'd accepted who she was. She'd accepted who this child was. And, you just sort of feel like, okay, they'll be okay. They can move on now. They know where they are. So it's just, there's a million everyday little things that make it, when you see these kids do well, that's why you know why you've done this all these years, why you didn't pick something like banking where you would have made more money. But it's the kids and the parents and the sibs, and we do have to remember the sibs because they get lost. so much attention has to be paid to the child with hearing loss because they need so much to make them successful that sometimes the sibs get lost. And we need to figure out a way to give them support, and help them understand that, yeah, this stinks that that this has happened to you, and that you have that you have to give up some of your parent because you have a sib who needs extra help. And when a parent says, or a grandparent says, or the teacher says, well, you're lucky you don't have a hearing loss. It's like, if you're 8, that's not, you don't feel that lucky. Or 10 or 12 or maybe even 15. So I think, we need to look at everybody and what everybody in that family needs. And the kid, I'm thinking about a kid who shows, I give 2 examples of a kid who shows up for an evaluation at 3:30 in the afternoon after school. And she walks in the door and she says to me, I am really annoyed that I have to be here. I hate coming for hearing tests. And I said, I don't blame you. It's 3:30, you've been in school all day long, you have to do this. And her mother said, you shouldn't be saying that. Jane's staying late for you to do, and I'm thinking, she's allowed to be annoyed. Let her be angry. Why should she have to do this? Everybody else went out for pizza, and she has to come and have a hearing test. How fair is that? And so I think, we need to think about where these kids' heads are at and be there to provide support for them, because it's hard. And yes, I'm in a hurry. I really don't want to have a sit down with you right now and talk about how awful it is to have a hearing loss. But if I don't do that, I'm not going to have a good hearing test. So I might as well just get myself together and know that I have to do that now. I had another kid whose mom had waited 3 months for an appointment. And the day he had the appointment, they were having a class trip to the zoo. And she said, you can't go on the class trip to the zoo because you have an appointment for a hearing test. Well, think about how happy that kid was to show up at my office when everybody in his class was going to the zoo. He wasn't a happy camper. And, we have to realize that these kids have to have other lives other than their hearing loss. Their hearing loss isn't who they are. It's just a piece of their lives. And we need to really be sure that we're providing for all those needs. That mom should have sent this kid to school. Going to the school trip was more important than having a hearing loss. We would have worked something out and seen him at lunch hour and gotten him done at another day. But he needed, we weren't dealing with what this kid's needs were other than his hearing at that moment, and that's not fair. He's entitled to be a kid, and that's what didn't happen. I think that we have technology now that will let virtually every child hear. But all of us who work with hearing loss, the audiologists, the speech-language pathologists, the auditory verbal therapists, the psychologists, the teachers, everybody has to realize that this isn't the same deafness that was there even 10 years ago. Certainly not when I was trained in the dark ages. Now kids have options, and we need to be saying to families, what do you want for your child? What is your goal for your child? Where do you want your child to be when they're 5, when they're 10, when they're 20? And what do we need to do to get there? We used to say to families, you have a choice. You can teach your child sign language, you can teach your child spoken language. What is your goal? But I think the question is a different question now. Now the question is, where do you want your child to be, and what does it take to get there? And so, when I say to parents, what's your goal for your child? Virtually every parent says they want them to speak and to talk and to go to college and to choose, to marry and have children and choose whatever job they want to have. And so, and that's a good goal. And I say, fine, let me help you figure out what you have to do to get there. And what we have to do now is different than what we had to do a long time ago. I remember a kid who lost his hearing from Crohn's disease when he was in college. He was a junior in college, and he was doing his junior year abroad. He was in England, I think. And he came, and he had the sudden loss of hearing, and he flew home, and he, by this time, had a profound hearing loss. and he was going to get a cochlear implant, and he walked into my office and he said, I'm going to college, I'm going to law school. And I said, fine. And he said, this is not going to stop me from going to law school. I said, you're right, it isn't. And apparently everyone he had spoken to had said, you're going to have to find something else to do, you can't do this. And I said, no, whatever you want to do, it's my job is to figure out how to help you get there. And he got a cochlear implant, and he had a really hard time because he had to learn to listen all over again with, distorted signal. But he was very determined and very bright, and he went to law school. And he was the head of law review in his senior year in law school. And he sends me the law journal that he was the head of law, that he had written. And he said, you're not going to understand any of these articles, but I want you to see that I got there. And he did. And so, anybody can get there. We just have to do what it takes to get them, to help them get there. Our job is to help them find the road.